Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the wellness dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast, Oral Health for Longevity. I'm Dr. Katie Toe, your host, and today I have a dear friend, the brilliant wellness dentist, Dr. Beena John, and she's have a really cool name. That's why her social is Dr. Beena. Like, you know, when you're cool, when you don't need your last name attached to your first name. So I'm really honored to have Dr. Beena John with us today. Again, we're going to talk about everyone's wellness journey. We're going to talk about how they implement it in their daily work and daily life. And so you don't want to miss this because her story is super powerful and it's very close to a lot of us are going through this situation right now with our parents. So Dr. John, welcome to the show.
Thank you, Dr. Katie, for having me. It's such an honor to be here.
We planned this for a long time.
Yes.
I know how it is with our schedule. So I'm so glad we finally got to sit down, even though on a Saturday morning.
I know. Thank you. Thank you so much for having me.
And so, like I said, you know, we met through different conferences and different opportunity, but what really turned you into wellness is your personal story. And can you share with us how that really impacting you and how you get started?
Yes. So for me, all of this started with my mother. She was a very strong woman. She was a nurse by profession, always took care of our health as children. She always knew what to do. And so if something was not right, she always looked for a way to fix it with our health. And so she just didn't let it pass. So that's how she's always been. She's been very in tune with health and her own health. And so early on, you know, she did have a few signs of like she would forget certain names, maybe places here and there, but nothing that was very obvious to us. I mean, we just thought, oh, she forgot, like didn't think much about it. But as the years passed, she herself noticed, I'm forgetting. Of course, by then we were already grown and out of the house. I was here in America. She was in India. And so she did go see doctors about it because, again, she always looked for solutions, right? And so they put her on some medications. I don't think it did anything because she told me that. And even then, I didn't really take it seriously. I just didn't think, just took it as part of aging and nothing more. And so she's like, I don't think these meds are doing anything for me. And I was like, oh, don't worry about it, Mom. Just forget about it. Well, then my dad passed away. And then when he passed away is when I started noticing her symptoms. And she had such a sharp decline from then on. And I think my dad compensated for her memory a lot.
I see.
Because when we talked on the phone, I never could tell. And how long do we talk, But even then I couldn't tell. And then when he died, and then we started noticing my siblings, and we just noticed like she just, couldn't remember things. And pretty soon dementia hit, hallucinations, and it just went downhill from there. And then to the point that she forgot me. And that was so hard on me. Wow. That really devastated me because she was physically there, but she was not mentally there at all. And then pretty soon the physical went away too. She fell, broke her hip, stopped speaking, lost a lot of weight. I didn't recognize her. She didn't recognize me at all. And so that was so hard on me. And so I started looking and I started investigating, like what causes Alzheimer's dementia? Because I didn't know anyone until I went through it. My mom went through this, right? And so it became personal. And I started looking into it. And then I came across this doctor by the name of Dr. Bredesen. And then he started talking about there's an end to this, that there's possible reversal to cognitive decline. And I was like, what? So then I bought his book. I started listening to YouTube and came across him talking about that Alzheimer's is a complex disease, many holes. And one of the big holes is oral health. And a light bulb went up. And I said, what? This is my field. I've been working in this for the last 20 years and I've never really connected it. I've heard, okay, pathogens in the mouth, again, can cause cardiovascular disease. Even then, but the importance was not really emphasized. We would just look at teeth, look at decay, and look at gum disease as you're going to lose teeth, but not about the bacteria that's causing other things in the body. And to me, that was like a huge moment for me. And I said, oh my goodness, if I can prevent one person from going down this road, then I found my mission.
Yes.
And for me, that was my turning point. And then, like everything I believe, nothing happens by chance. And to me, it was by divine appointment that I met with you. And again, like we said, we didn't start off to go into biological dentistry. It was other means, but meeting with you and then hearing about biological dentistry and seeing that was where my desire, my passion was headed, it just transformed how we started practicing and how we've changed our practice from a regular dental practice to a biological
And wellness
practice
practice.
and wellness practice.
Yeah.
And so that's kind of how we started
Yeah.
this journey.
I had to have a reminder for a lot of our listener and audience, like even though you friend and you know each other and we talk to each other quite often, see each other on Zoom every week. I have to say, make the time to sit down with your friend and hear the story. I got emotional, hear your story because I know about your mom, and then I know that when she passed and you travel home and see her, but I didn't know that she forgot you.
Yeah.
Like those are huge because your mom, like
Yeah.
I could never imagine my mom like forget me, And so take the time to have a conversation with your friend, don't just like checking in, but really asking questions and listen. So thank you for sharing that today.
Yeah.
I got emotional when I realized that, oh gosh, I have to have a deeper conversation. You don't have to have a podcast to have this conversation. You can have this conversation when, you have on the phone or like FaceTimes or sit down for a coffee. But thank you for sharing that. What I noticed, Beena, once you realize that this is something I can change and help patient, you went all in.
Yes.
You were not tiptoeing and I say, oh, let me start with ozone or let me start with this. You like, teach me everything.
Yes.
Give me a fire hose. And not only that, you fully implement in your practice and then you also build a new practice.
Yes.
Relocate your practice.
Yes.
Just so you can do this 100%.
Yes.
I love that about you. That determination and that commitment is not easy
Mm-hmm.
because we have other dentists coming to us and ask the same thing. Can you help us to implement biological wellness in our practice? And they scare.
Yeah.
But you went all in. So what were you thinking when you were like, I no longer want to practice this way. I want to go all in. What were you thinking? What your family were thinking, and what your team was thinking?
Well, they didn't. So as far as my family, they knew me talking about it because as soon as I started reading about this, understanding that I play a big part in this end of this chronic disease, this debilitating disease, that I could play a part in it. They sort of understood, because I was always talking about it.
Yes.
Always talking about it, always talking about how, the things that my mom, that I knew, the some of the things that I knew about her health, that I'm like, I'm going to tackle this on, so they knew, but they didn't know the extent of how this was going to impact me in a daily dental practice world.
Yes.
Because they don't come with me to work or anything like that. They just know me from when I'm home, and when I'm a wife or I'm a mom, that's all they know about me. But of course, I started implementing things at home, so anytime my kids, even they know, because they're like, oh, mom made something healthy, so it probably doesn't taste that good. So for them, that was always like I'm like, not enough sugar in here. No, we're not going to be eating all the stuff with sugar anymore. So for them, that was the impact of food maybe not being that tasty anymore. I'm like, well, if it's tasty, it's probably not good for you. So they've kind of been conditioned a little bit in that way. My husband's been very supportive. He likes everything healthy and he likes going that route. And once he knows something, he follows through. He follows doctor's orders like anything. So it was easier for him to kind of go that route also. And then at work, we slowly, of course, even though we knew a lot, we couldn't we had to get everybody on board slowly, so we did encourage them to, listen, go to, listen to these master classes, understand what we're talking and constantly just giving them information until it finally slowly started sinking in. Yeah, we are not just saying it, but we're going to do what we're saying.
That's right.
We're going to start implementing, of course, all of it. There's a lot of technology involved. There's a lot of equipment involved. But we'll do it at the capacity that we can slowly, as we implement one thing, we're going to master it and let's get the next thing and keep going at this journey. So at work, we've just kind of started doing it that way, just, ozone, the microscope, just, looking at the airflow, the CBCT, looking
surgery,
at exactly
the zirconia implant.
Yes. Just been like one thing after the other that we've been able to implement. Screenings, the way we do an oral exam, everything has just changed so much. So
I got an opportunity to work with Beena, her partner, Dr. Troy, and her team. Met every single one on her team. Really spent a lot of time with your team at the beginning when you start this journey out. And I have to say, the leadership, people trust you, your team love you, and the patient, because you are not the practice where I'm going to do this and attract new patient. You're actually converting existing patient, especially with Troy, your partner, been in this practice for 30 years.
Yes.
These patients love you and trust you. And now you are like, we're going to test saliva now. We're going to check all this biocompatibility now. And we're going to do, dentistry this way, the whole body way. And people love you and trust you to follow your guidance and seeing the benefit.
Absolutely.
And so I know a lot of dentists, when they hear that, am I changing my practice from the conventional to this wellness way? Am I losing patient? Yeah, some patient who not value or not understand the value of the whole body health. Yes. But guess what? They come back.
Yes,
they come back because they know you're not treating them as a number. You're treating them as a unique person. Because if one size fit all, then why we still have chronic diseases? Why your mom had to deal with that? It is a personal approach to each patient, because the last thing you want is something like that happen to anyone you know.
Yes.
Or even ourselves. A lot of time we do it out of fear.
Yeah.
Like you've seen what happened to your mom and you're like, I don't want to forget my daughters.
No, absolutely not. I don't want to go down that road.
Yep. So it's selfish, and it is that we want to protect ourselves. But at the same time, isn't that what driving us to do things for others?
Yeah.
Because we figure things out, right? So I always look at the Beena like a super wellness dentist, because I could not do a lot of things that she is doing, especially surgery. She actually one of a very few female wellness dentists in the world placing zirconia implant. So share with us a little bit about, you've been doing so many cases that you start seeing. You start out placing titanium.
Yes.
Because she loves surgery. Then when she started this journey, she's like, oh my God, I need to get all in on this zirconia implant. So interesting that you see the difference between the two. So share with us, what did you notice the difference between the two implant system?
Well, first of all, I noticed that there, once we started doing some, testing biocompatibility.
Yes.
That was the first thing. And realizing that everyone's body is so unique. Yes. Immune system is so unique. And to know how certain materials work with your body was just eye-opening. And I noticed that from the people that we tested, many were sensitive to titanium, number one, when they were not sensitive to ceramic, or they were sensitive to both.
Right?
So they couldn't handle either.
That's right.
They couldn't handle
Because
either.
their system.
Yeah, their body just couldn't handle it. So I wouldn't even, so hey, in the past, we may have placed a titanium on them when their body could not have handled anything, could just not handle an implant at this point, right? Until
not never.
Not never,
Yeah,
but
hopefully.
yeah, exactly. And so that was the first thing. And then when I started placing the ceramic implants, I also saw how well the tissue responded to it.
Yes.
It was beautiful. Just beautiful response of the tissue. Because usually when I do an immediate titanium, especially, you take in, of course, it's an extraction. The tooth's coming out right away. You expect some irritation around the gums. And with titanium, it would take at least a month or whatever for me to see that tissue response, right? To be completely kind of. But with the ceramic, when they came back for a follow-up, I'm like, wow, I'm amazed how well this tissue has responded. So that's the first thing.
Yes.
The
body is speaking, right?
I noticed.
Yes.
How well it responds to that implant. And then, I always wait a little longer when it comes to ceramic implants. And then even ones that I would have thought, I've seen this happen where I thought, okay, for this person, it took a little longer for that implant to integrate. With titanium, I think I would have probably considered that a failure. But with the ceramic, I, kept it in a little longer, and sure enough, it integrated.
So healing takes time.
Healing took time.
Yes.
It took time for and for certain people. It just takes a little long. It all depends on how your body is responding, and what, how you're taking care of it, right? Your immune system, what kind of vitamins, supplements you're using, all of that play a role in how this foreign body responds to your, in your body. Yeah. So I've just had good results.
Yes.
With the ceramic implants. So I've been really happy placing them.
You were very rare because a lot of wellness dentists, they don't do this surgery, especially female surgeon, because this requires a different set of skill, right? Anyone can remove a tooth biologically and clean it all out and let the body heal, but not everyone can place and restore. That's a very different set of skill that people actually go to residency to do that. And you invest a lot in education for that.
Yes.
But I think what Dr. Beena mentions is kind of a reminder for all of us that, number one, our body takes time to heal, right? We know this through childbirth. Like, you want to have another baby, you have to make sure your body recover. Yes. You can't just not literally get pregnant right away. You have to go through that recovery. And then second is like, all of us are unique. Like someone would, like my team member, Dawn, she's allergic to banana, but I love banana. Like, doesn't mean banana is bad for you, but it's mean that it's not compatible with that person.
Yeah.
And when we treat the person, we forget that it's not the same person every time. And so whenever we treating people, we always said, who are we treating?
Yeah.
How's the body respond to things? And so you can research and look online and follow everyone else's journey. But when it comes to your journey, you have to focus on your body, how to make your immune system the strongest, right? The best possible to receive material or supplements or things that going to make you be able to be a better candidate to get this. Because nobody want to walk around with no teeth.
Yeah.
And quality of life, confidence, all of that. But I realized that a lot of people want to rush the process. What do you mean I have no teeth for this many months? And I'm like, yes. And once you get restored, you got to keep it for a long, long time.
Yeah.
Yeah. So don't rush the process, okay? Don't come to you, Dr. Beena, and say, I want to have this done in 2 months. We're going to ask how your body is going to do that.
Yeah.
Right. So I love that reminder a lot. And you always said, but I can't do what you do. So I love and admire you to invest in yourself, really enjoy the surgery.
I do.
Every time she
I do.
speak about surgery, she's like light up.
Yes, I do. I do enjoy it.
She would love to do that every day. So, Dr. Beena, you mentioned about things that you're doing at home, and then of course all the things that you're doing at work. What are the 3 non-negotiable daily wellness practices that you be like, no matter what happened, I'm doing that every day for myself?
So one of the things I started implementing is to get good quality sleep. So my mother, one of the things I knew for sure was that she had a hard time sleeping. So then that progressed. She would take, sleeping pills and things like that. So that's the one thing I know that she did. Sleep was a big issue for her. So when I started going through, perimenopause and all these things, when you hit your 40s, I started noticing my sleep also, right? And so I was like, okay, I need to, this is one area that is a non-negotiable for me, is making sure I do nasal breathing. I use the X-Clear to do a nasal cleanse, and then to wear my sleep appliance every night. And then take magnesium. So that is one thing I do. And so that's like a non-negotiable.
Yes.
I've been getting good sleep with that. So
super.
Yeah. And then for me, the other thing would be I've been listening to the Daily Growth Fire.
Coach Brandon Bashar, you're so proud.
Yes. So I loved what I heard even yesterday when he said about wellness starts from within. I loved it. And I said, oh my goodness.
Yes.
Yes.
I listened to it twice.
Yes.
Morning and then before I go to sleep, I need to listen to that again.
Yes. So I loved it. I was like, yes, that's absolutely true. It starts from within. It's how you speak to yourself. It's what you go through, how you motivate yourself daily. Because daily, there's always things that are going to come against you. But how you fight it, how you speak. And so, listening to that daily. And I use that every day to talk to our team.
Yes.
So we use that for daily fire. So they look forward to it. So if I don't give them a daily fire during morning huddle, they'll be like, what's today's daily fire?
I love the accountability.
Yes. So they'll be like, and so I connected some, even though it may be like personal, I also bring it to somehow how we can work as a team. Because it's all and serve our patients, because that's our goal.
Yes.
And the third one for me is movement. So, of course, my daily goal was 10,000. I don't always achieve 10,000 for whatever, circumstance. I don't have a treadmill. I hope to get one soon. That will maybe make me get the 10,000.
Yeah.
But some kind of movement, whether, so if I just walk around our office building like 2-3 times, it doesn't hit 10, but at least I'm getting, 3,000 or 4,000. And then I also have a Life Pro vibrator plate.
Yes.
And so I come home and I do that. So that's been my non-negotiable. Some kind of movement.
Yes.
Daily.
Yes.
Daily.
I love the vibrating plate.
Yes.
It's amazing for the lymphatic.
Yes.
And also balancing.
It is. Yes. And then it really works your muscle, because I'm a little sore. I'm a little sore after that. So I'm getting that too.
I love that every guest on the show, we always ask that 3 non-negotiable wellness, and everyone to them, all different things. But what remind me is it's never just physical.
Yeah.
It's also mental, emotional, spiritual. And that's what wellness is about. It's, people sometimes focus too much on the physical. They go dive all in, like to the T of the supplements and all the movement, the activity in the body, and forgot about the mindset and the spiritual, right? The purpose and all the things that really get us up in the morning and get out of bed and go and save the day. Right?
Yes.
So thank you again, Dr. Beena, for spending the time with us. We're going to see Dr. Beena again on the next episode with her partner, Dr. Troy, and we're going to talk about a whole next level of how wellness in partnership in dentistry that people thought is not possible, but they've proven that that's wrong. So see you guys at the next episode. Don't forget to subscribe. And Dr. Beena, I know people asking, how do they follow your wellness journey, asking you questions, reach out to you. Can you give us your social handle that they can follow you?
So on Instagram, you can find me at Dr. Beena.
So cool.
And then on Facebook, there's Dr. Beena John.
Awesome.
And then our practice Facebook is Eagle Dental, Texas.
Awesome. I will put all of that link in the show note. And so you can follow and ask Dr. Beena questions. And if you really have, need an appointment, she will get you in. Okay. All right. Thank you, Dr. Beena.
Thank you.
And thank you, everyone. See you next time. Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.